Dr. Shaun Batte from the Urban Athlete, and for this month's newsletter video, we're going to talk about shoulder pain and be more specific, things that we should try to avoid exercise-wise when we have shoulder pain, and some exercises that are generally more safe that we can feel pretty safe doing, knowing that we're not going to be necessarily harming ourselves. So first, what I'd like to talk about is a couple things to avoid when you have shoulder pain. Now, of course, this video is in no way diagnosing any shoulder pain. Obviously, that's up to your regulated health practitioner to do that. But what this video does is provide a little bit of added information. Maybe you are not doing any exercises, maybe you're already getting seen by somebody and there's no rehab exercises there, or maybe you're experiencing a little bit of diffuse shoulder pain and like to try a little bit of something and just want to feel comfortable that you're not worsening the pain. So first off, when you have any kind of shoulder pain, now this is very general, but generally when you're exercising, you do not want to raise your arm above 80 or 90 degrees. So that includes exercises like shoulder press. It also includes the lat pull down. Anything that it requires you to reach up above shoulder level, it should be avoided, because it can cause further impingement in the shoulder. Another thing to avoid is internal rotation of the shoulder, especially when you get up into kind of these closer ranges of abduction. So internal rotation at this level is pretty safe, but when we're into this range of abduction, you want to avoid that. The third thing I'd like you to try to avoid is movements not in the scapular plane. So what I mean by that is to show you sideways, when I reach my arm straight out laterally, the scapular plane is actually about 30 degrees in front of the lateral plane, right in line with the camera here. So 30 degrees in front, the reason it's called the scapular plane is because it's the plane in which our scapula rests on our thoracic cage. And this is a very stable position for our scapula, so we know that when doing exercises in that plane, we can rest assured that they're going to be a little bit more, we're going to be stronger and less likely to hurt ourselves. So just to reiterate, things to avoid. A really big exercise that a lot of people love to do for their traps, but we should definitely avoid with shoulder pain, is the high row, which involves both internal rotation and a higher degree of abduction in the shoulder. Okay. Another thing to avoid is, like we talked about, exercises that involve our arms to be behind the scapular plane. So things like behind the neck shoulder press, or in the opposite way, behind the neck lat pull down. Okay, so some exercises that are great to incorporate into your workout are ones that, these are very foundational exercises, but they are targeted towards both scapular stability or shoulder blade stability and towards the rotator cuff muscles. So exercises such as a low row, which is done just like this. So I just have some banding tied to a knob here, and I'm just pulling straight back, is very good for the lower traps. Another one, of course, you've seen the normal row or just the midline row where you're pulling it straight back, and this one's great to actually be done bilaterally. So you're pulling back, trying to almost touch your elbows behind your back, pinching your shoulder blades together. By strengthening those, you're really stabilizing some of the muscles that help to depress our shoulder blade and keep it tight against our thoracic cage. Some other really good exercises include external rotation. Now this banding should be perfectly level. I know it's a little bit low here. And then I'm going to switch arms and show you internal rotation. Okay. And like we talked about, scaption or scapular plane, that's a lateral raise, but it's in the scapular plane, so it's slightly in front of us. Okay. So you'll notice that my thumb is up, so it's in a neutral grip. If the palm is down, that's actually your shoulders in a slight internal rotation, and that's one thing we want to avoid. So we're going to come up to roughly 90 degrees or slightly below and come back down. So that's another really good one called scaption. And to finish off, another really good exercise is what we call Codman's exercise, or basically a traction on the shoulder. So we grab onto something that's heavier, and we can lean over on, bracing ourselves on a chair or on a bench, and basically let the weight pull our shoulder down and just do small circles in one way and then the other. And what this does is allow a little bit of traction, allows the shoulder to open up a little bit, relieving some of the structures that are potentially impinged. Okay,